Hello everyone. Today we are going to discuss about a topic that is HIV in pregnancy, or how we are going to take care of a newborn of a HIV mother. So let's start. First is, what is HIV? HIV, the full form is human immunodeficiency virus, is a virus that causes AIDS, that is acquired immunodeficiency syndrome. As you know, it is a very common word and everyone is familiar with this word. An AIDS infected person cannot fight off disease as they would normally are more susceptible to infection, certain cancer and other health problems that can be life threatening or fatal. Next is definition of AIDS. Acquired immunodeficiency syndrome is defined in terms of either CD4 T cell count below 200 cell per unit liter, or the occurrence of specific disease in association with an HIV infection. Next is transmission of HIV. HIV is transmitted by three main routes, means how the HIV is transmitted from one person to another person or from mother to baby. So it can be transmitted in three ways. One is sexual contact, means if HIV infected person is having sexual intercourse with another healthy person, it can be transferred. Next is exposure to the infected body fluids or tissue. So if you are giving infected blood or fluids to the another person, also it can be transferred from mother to the child during pregnancy. This is the very important, as we are studying about the pregnancy in new HIV. So from the mother it can be transferred to baby during pregnancy or delivery or breastfeeding, and known as vertical transmission. So this is the three way how HIV is transferred from one person to another person. Main thing is HIV can be transferred through body fluids. Okay, it may be blood, it may be serum, it may be semen, okay, it may be breast milk, anything which carry body tissue or fluids. Through that HIV, this virus can be transferred to another person. Next is signs and symptoms. So first, signs and symptoms are there are three main stages of HIV infection: acute infection, clinical latency, and AIDS. First, you will see acute infection. In the acute infection, what are the things you will notice? You will notice influenza like illness. You will be seeing the fever, larger tender lymph nodes, throat inflammation, macula pulverization rash, headache, sore of the mouth, anginitis, nausea, vomiting, and diarrhea. These are the signs you can notice in acute infection. If it is like normal for few days only, the person is having HIV. Next is clinical latency. In the clinical latency, you can see the fever, means if it is for longer period, okay, you will see the fever, weight loss, gastrointestinal problem and muscle pain, and persistent generalized lymphadenopathy. Okay. Next is AIDS syndrome. Okay, that is acquired immunodeficiency syndrome. In that, what you can see, main syndrome of AIDS is in the central nervous system. You can notice encephalitis and meningitis. Okay, inflammation of the brain and inflammation of the meninges. In the eye, you can see the retinitis. In the lungs, you can notice pneumocystitis, pneumonia, tuberculosis, multiple organ. Okay, tuberculosis means not only lungs tuberculosis, maybe abdominal tuberculosis or brain tuberculosis. Okay, tuberculosis can occur in the any organ of the body. And the tumors, that signs you can notice in the lungs. In the skin, you can see the tumors. And in the GI system or gastrointestinal system, you can see esophagitis, chronic diarrhea, and tumor. So these are the signs and symptoms based on the stages. In the acute cases, you can see some symptoms. In the clinical latency cases, you can notice some symptoms. And in the AIDS, like if it is in the last stage, okay, then you can notice these are the symptoms. Next is pneumonitis. In the pneumonia, like 40% cases. Okay, cachexia in the form of HIV wasting syndrome in 20% cases. Esophageal candidiasis, recurring respiratory tract infection, opportunistic infection. People with AIDS have an increased risk of developing various viral induced cancer, including Kaposi sarcoma, Burkitt's lymphoma, primary central nervous system lymphoma, and cervical cancer. Means the person who is having HIV infection, they have more chance to get various type of cancer. Next we have stages of HIV or AIDS according to the WHO, that is World Health Organization. The first one is stage 1. In the stage 1 it is asymptomatic, means there will be no symptoms. Okay, we can't see any symptoms in the first stage. When the person is affected with the HIV, normally you will not able to notice any symptoms. Next is stage 2. In the stage 2 you can see unexplained moderate weight loss. Okay, means without any reason there will be a weight loss, and it is moderate, not that much more. Okay, not severe, moderate. Recurrent RTI, that is recurrent respiratory tract infection, herpes zoster infection, angular cellulitis, okay, cellulitis, recurrent oral ulceration, seborrheic dermatitis, and fungal nail infection. So in the stage 1 you are going to see asymptomatic, means you are not going to see any symptoms in the stage 1. In the stage 2 you are going to see these are the symptoms. Next, in the stage 3, there will be unexplained severe weight loss more than 10%, unexplained chronic diarrhea more than 1 month, unexplained persistent fever more than 1 month, and persistent oral candidiasis, oral hairy leukoplakia, pulmonary tuberculosis, severe bacterial infection, acute necrotizing ulcerative oral infection, or unexplained anemia and neutropenia. These are the things you can notice in the stage 3. Next is in the stage 4. In the stage 4 you can see HIV wasting syndrome, bacterial pneumonia, okay, herpes simplex virus infection, esophageal candidiasis, okay, or EP tuberculosis, okay, other organ tuberculosis, Kaposi, sarcoma, CMV, toxoplasma, this CMV means cytomegalovirus infection, toxo means toxoplasmovirus infection, HIV in encephalopathy, okay, cryptococcosis, cryptoisomycosis, septicemia, lymphoma, and cervical carcinoma. Next is CDC classification system for HIV infection, means based on the CD4 count how we are going to classify. There are 4 classification. One is stage 1, 2, 3 and unknown. In the 1, if the CD4 count is below 500, if 2 it is count between 200 to 500, in 3 it is more than 200, and unknown case in if it is insufficient information is available to make any of the above, means you are not going to find out any of the above count, so it will be the unknown classification. Commonly used ARB drugs, that is antiretroviral drugs, okay, that is nucleotide reverse transcriptase inhibitors, okay, nucleotide reverse transcriptase inhibitors, protease inhibitors, non-nucleoside reverse transcriptase inhibitors, and entry inhibitors. Next one is in example of nucleoside reverse transcriptase inhibitors like zidovudine, that is 600 mg, lamivudine 150 mg, okay, stavudine 40 mg, denanosine 400 mg, and abacavir 300 mg. Next one is nucleotide reverse transcriptase inhibitors. Example is tenofovir 300 mg. Protease inhibitors like indinanir 800 mg, ritonavir 600 mg, and entry inhibitors like enfobitate 90 mg. See, these all are the name of the ART drugs. ART means antiretroviral drugs. Okay. What is mother to child transmission? This is the very main part that we are going to study here in OBG. Mother to child transmission is the when an HIV positive woman passes the virus to her baby. Okay, means if the mother is positive of HIV and he passes or she passes that virus to the baby, that is mother to baby transmission, and this can occur during pregnancy or labor and delivery or during breastfeeding. Means this can happen in any time of the pregnancy period or during labor or during the breastfeeding time also. Without treatment, around 15 to 30% of the babies born to HIV positive women will become infected with HIV during pregnancy and delivery. Means if the mother is not getting any treatment for HIV, so in that case, like 15 to 30% of case, the HIV will transfer to the baby. a further 5 to 20% will become infected throughout the breastfeeding, and remaining 5 to 20% will be infected throughout when mother is giving breastfeeding to the baby. Mother to child transmission is the main cause of HIV infection in children. It can occur during pregnancy, during labor, and during breastfeeding. So prevention of unwanted pregnancy. Option of medical termination of pregnancy given to the positive mothers. If they are willing for the MTP, medical termination of pregnancy, then it should be done. Means like if HIV mothers, they don't want pregnancy, but like accidentally they got pregnant, so they will go for MTP, that is medical termination of pregnancy. Next is time of HIV transmission. As I told, pregnancy time it can be transferred, postpartum time it can be transferred, labor or delivery time also it can be transferred, and in the infancy period also it can be transferred. Next is maternal risk factors. There will be a high viral load, HIV subtype, resistant strains, advanced clinical stage, concurrent STI, recent infection, viral, bacterial and parasitic placental infection, and malnourishment. Next is intravenous intervention during pregnancy. Means what are the things we have to take care during pregnancy. The prevention of PTCT, that is parental transmission through the ART to the mother and baby, and safe obstetric practice. Clinical staging of positive mother, baseline CD4 testing, treatment of concurrent STI, means that is sexually transmitted infection, recent infectious viral, bacterial or parasitical, safe sex practice, and nutritional counsel. Means if already they got pregnant, these are the tests you can do, or these are the planning you can do for the woman during pregnancy. Next is choice of ART or ARV prophylactic regimen for HIV infected pregnant women. See, I have told you so many medicine names, but all the medicine we can't give to pregnant women. Okay, so there is some of the drugs which will be like, I not say it is good, but we can give in the case of if the mother want to continue their pregnancy. Like the recommended first line ART regimen for HIV positive women are, okay, so TDF 300 mg and 3TC 300 mg or EFV 600 mg. This all short form already I have explained in the medication. Okay, and available as an DC in one single pill if there is no prior exposure to an NRTIS or NBP or EFB. The next one is ARB prophylaxis eligibility criteria. Means when we can start the medication for the pregnant woman before 14 week of gestation, means 14 week of pregnancy. Next is ART or ARB prophylaxis initiating regimen. How will start? We'll start with the TDF 300 mg or 3TC 300 mg or EFB 600 mg. Okay, it is once daily pill and preferably to be taken at the bedtime. When to stop ARB prophylaxis? In the time of breastfeeding, mother continue regimen until 1 week after the breastfeeding has been stopped, and then 7 days till, okay, of the TDF and 3TC. Infants daily and baby from the birth for the 6 weeks. For the baby also you have to start. Next is intervention during the labor and delivery. Till now whatever we have studied the intervention during the pregnancy. Now is intervention during the labor and delivery. In case of vaginal delivery, the vaginal cleansing with 0.25% of chlorhexidine and avoid instrumental deliveries. Okay, instrumental deliveries means why means like during instrumental, if there is any accidental injury or any cut, and there will be bleeding and there will be more easily transmissible from the mother to the baby. And do not shape the pubic area, give an anemia, rupture membrane, and perform episiotomy. In case of cesarean section, if the mother is taking combination of antiretroviral therapy, then a cesarean section will often not to be recommended because the risk of HIV transmission will already be very low. So cesarean delivery may be recommended if the mother has a high level of HIV in her blood. The next one is intervention for the newborn. Institute NBP to the baby with 72 hours. Means Within 72 hours, we will start the baby with the medication. Determine mother feeding choice before attaching to the breast. Clean injection site with surgical spirit before administering injection. Do not use suction unless absolutely necessary. Next is HIV and safer infant feeding. Mother with HIV are advisable not to breastfeed whenever the use of breast milk substitute formula is acceptable, feasible, affordable and sustainable and safe. Means unless it is necessary, they can go for formula feeding. Infant feeding risk factor influencing PTCT, that is mother is infected with HIV while breastfeeding. Breast pathology like any problem with the breast like cracked nipples, mastitis or engorgement, advanced HIV disease in the mother, poor maternal nutrition, mouth sore or an inflamed GI tract in baby, mixed feeding like breast milk along with other foods, and prolonged breastfeeding like 6 to 18 months. Next is care of newborn continuations. Wash newborn after birth, especially face. Avoid hypothermia. Give antiretroviral agent if available. Breastfeeding issues, you have to take care of it. Warmth for the newborn, nutrition for the newborn, and protection against other infection. Next is HIV diagnosis in infants. Antibody indirect tests such as an ELISA or rapid test cannot be confirmed HIV infection in infants younger than 18 months of age. So the infants still carry antibodies from the mother. Positive results at this age indicate infection in the mother, HIV exposure and possible infection of the infant. Next is, therefore, biologic direct tests such as DNA or RNA PCR are necessary for the definitive diagnosis. Means normally they will go for ELISA test for HIV confirmation, but in case of infants they will not find out it because below 18 month of age it is not possible to confirm. So they will go for DNA or RNA test, and positive DNA or RNA PCR result confirm the presence of virus in the infants. Thank you everyone. So with this we have completed the HIV in pregnancy. Thank you.